and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, Head Lice, Practical Approaches in Management. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be awarded for 1 year for nurses, expiring on October the 30th, 2016, and 2 years for social workers, expiring on September the 30th, 2017. I'm Shirley Offit, Surveillance and QI Branch Manager with the Epidemiology Division of Communicable Disease at ADPH. With me today is Dr. Karen Landers, Assistant State Health Officer and Medical Consultant for the TB Control and Immunization Division. Welcome, Dr. Landers.
Thank you, Shirley. I appreciate the opportunity to be with you today. And we're going to talk quite a bit today about a subject that causes a good bit of angst among parents, among schools, and even among children who have this problem, and that's the subject of head lice. And I want to talk about some practical management issues today, and that's really been my message as a pediatrician, having seen children through the years with head lice, having dealt with this myself as a mother. I believe it's very important that we get correct information out to the public. So I want to talk about the objectives. What I'm going to mention today is the scope of the problem with head lice. You know, how did we get where we are today? And I want to talk a little bit about the life cycle and transmission, because I think there's a lot of misinformation about how people contract head lice. Additionally, I want to talk about signs and symptoms, because parents are concerned, you know, does my child have head lice or not? What do I need to do? What are signs and symptoms I need to be aware of? And finally, I will talk about the management of head lice. And I think it's very, very important to understand that while some of the management has changed, the core principles are the same. And that is that we want to treat children appropriately, we want to use an effective agent, and we want to use the agent that is least toxic and least expensive to the family as we are dealing with this particular problem. Now let's talk about the scope. Okay, well, head lice certainly has been around for many, 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 many years in medicine, and certainly we know that it is a parasitic infection of the scalp. Head lice are basically parasites. They have nowhere else to live off of the scalp, really. When you're talking about head lice, they are not able to be viable for very long off of the scalp because they don't have a way to feed otherwise. Now, it's really staggering to realize that quite a bit of money is spent on head lice treatment, and we also have to consider lost wages that parents might experience or caregivers might experience while they have their child undergoing treatment for this, and we also have to consider expenses that this might cause the educational system in assessing, providing information or education to the family. So there are expenses related to the school system here. But I want to talk about urban legends, and I want to put head lice into perspective, okay? Head lice are not responsible for other severe diseases. Head lice are basically nuisances. So they're not responsible for transmitting other diseases, and I think we all need to accept that and be aware of that. Again, cause a lot of anxiety, you know, cause a lot of issues in terms of getting them treated and managed, but you're not going to develop other severe health complications as a result of having head lice. And this really leads into the next statement that I want to make of the urban legends. Patients who have head lice are dirty. That's not correct. Head lice affect people in all socioeconomic groups, all levels of household cleanliness, so that people who have head lice do not need to be ostracized from the rest of the school, the rest of the children on the playground, the rest of society. Head lice do not happen just because a person may not be quite as clean. Head lice can affect anyone. Patients who have head lice do not wash their hair. Well, again, that's not correct, because head lice, certainly one of the ways they survive is that when the eggs are first laid onto the hair shaft, these head lice have a nice little glue that helps them stick to the hair, so that they've got a way for that egg to mature and then hatch, and so that's really their way to survive. So again, washing hair does not get rid of head lice. Only poor people have head lice, and again, this is an issue that all of us deal with. People that might have, less opportunities in medicine, they might have less money to purchase products, and they don't have the same situation that other children in the school system. Only poor people have head lice. Well, that is totally not true. Again, as a pediatrician myself, I have seen head lice in all socioeconomic groups. I've had friends call me at night. I've had people come up to me in a social setting or at church or whatever. They felt like they could talk to me because I worked in public health, and they felt a stigma related to head lice. So we need to get rid of that. Head lice can happen to anyone. One of my favorite urban legends that I like to remind people about is that head lice jump from scalp to scalp. Head lice do not jump. Head lice are transmitted basically from contact to contact, if you will. Now, I will mention fomites in just a minute, but basically it's that head-to-head contact. That's why you do tend to see head lice more commonly in a daycare or an early to middle school situation, where kids still are not quite as worried about their personal space, and they might be very, very close together. Now, I will say that there has been some information in scientific literature that if you comb dry hair and you have a lot of static electricity, that a head louse could conceivably be removed from the hair and go for about a meter in the air. But really, the reality of it is head lice don't jump, and they're transmitted by contact. Now, I have immediately after that, I have people say to me, well, what about sharing caps, combs, and headgear? Okay. Now, it is possible to develop head lice from fomites. However, we have to remember that once that louse leaves the head, and why does that louse want to leave the head? I mean, that's a place that they can eat. They can, get some nourishment there. They have no reason to leave a healthy head. But if the lice does get on a hat or comb or headgear, well, that louse has just lost its way to eat. So it's really not going to live for very long. Now, eggs, once they're removed from the scalp, they might be viable for about 24 hours or so. Adult head louse is not going to live for even a few days. So it's very, very important to recognize that while fomites are something we need to be aware of, for example, in treatment, we're going to wash hats, we're going to wash caps, we're going to sanitize combs with soap and water, but we're going to wash off headgear, for example, if kids are using helmets or something of that nature. But that does not mean that that's how they got head lice. They got head lice from contact with another person's scalp for the most part. And I always remind people that we don't want to avoid using bicycle helmets because maybe someone had head lice, okay? If we are going to a situation where, a place where there's a bicycle camp or something and there are bicycle helmets available for children there that did not bring their own, we don't want to avoid headgear as a result of our concern over head lice. So I want to make that very, very clear. And then all nits must be removed from the scalp. And I want to mention something for the purposes of my talk. I talk about lice eggs and nits really as a separate category. Some of the American Academy of Pediatrics literature refers to, again, lice eggs, which is basically the egg, and then the nymph will hatch from the egg, leaving a white casing, if you will, which I refer to the casing as a nit, and that's what some of the literature refers to. Other people will use the terms interchangeably. But after treating a child, I think it's very, very important to be aware that you don't need to remove every nit from the scalp. Now, yes, we want to try to remove the nits that are cosmetically significant, if you will. You know, once we've treated a child and they have empty nit casings on the scalp, it doesn't look very good if a child has a lot of nits, and they may be subject to, you know, being bullied in school or being harassed, or, you know, kids do those sorts of things because they don't understand that they're not supposed to sometimes. So it's very, very important to be aware that it's good to remove as many nits as you can, and it is a little bit challenging. I'll talk about that in a moment when we talk about treatment. But all nits don't have to be removed, and we really should not exclude children from school who just have nits in their hair, you know, after they have been treated. And this is a recommendation not only of the American Academy of Pediatrics, which is an organization of over 60,000 pediatricians, but also a recommendation from the National Association of School Nurses. So I do think that's very, very important. Now what is this this parasite that causes us so much trouble? Well, again, this is an adult louse here. It's about the size of a sesame seed. They're brownish, tannish in color, and they have 6 legs. And I've seen quite a number of these in my career. I used to have a little test tube that I would keep around to show my medical students. I think one of them took it with them when they left, but show them what an adult head louse looks like. But a lot of times we may only see lice eggs close to the scalp, and we have a picture of that a little bit later in the presentation. But again, as I mentioned, these are about the size of a sesame seed. They do have 6 legs. They're sort of a tannish gray color, and these are our adult lice that we're talking about. Now, if we're talking about eggs, and again, I'm going to mention that eggs to adults, the life cycle of the head lice, we have to remember that, first of all, the adult female louse can lay eggs about 1.5 days after maturity. So they can be quite active and can be laying those eggs up to about 4 weeks or so if we don't treat this infestation. The eggs have to have the body heat to incubate. And we'll talk a little bit about life cycle. It takes probably about 7 to 9 days or so, you know, for these eggs to hatch and go through the nymph stage. And once the eggs hatch, again, that leaves our casing, that leaves our nit there. And it will go through about 3 stages. The nymph will go through about 3 stages. And the little nymphs are, they almost look like, I guess you might say, the babies of those adults that I showed the picture of, but they can be seen, again, in various stages of development in the scalp, depending on how long the infestation has been going on. And as I said, once the female louse gets busy laying these eggs, depositing these eggs along the hair shaft, and this is usually right around the base of the scalp and around the ears, and the reason for that being is that's just a really nice warm place for these to be deposited so that they can grow, incubate, and become adult lice.
Now, are these nymph the same color as the tannish brown, or are they the white?
Actually, nymphs can be, and if an egg is in an egg case, you know, an egg is laid close to the scalp. One thing that can make it a little difficult is that you can have a pigment, really that is a part of the physiology there. You can have a pigment that is actually in that egg that is almost the color of the hair. So you may see people with lighter colored hair. They have a lighter looking louse egg on the hair as opposed to a person with darker colored hair. So that pigment can make it a little difficult. But once that egg has actually hatched and that casing is left, what I call a nit, those are white. They actually look like a piece of grits, I guess, for lack of a better word. I explain to people that, you know, there's a difference in the way the egg tends to look brownish beige or almost black, as opposed to the casing, which looks more like a piece of grits or even a piece of fuzz. I've had people bring in pieces of pillow fuzz that they thought, you know, was head louse. And again, a viable louse is not going to be snowy white. So I think that's something that can help us, because this is something that, again, school nurses have seen, pediatricians have seen, family physicians have seen. But if you've not seen these, sometimes You can confuse, even a piece of hairspray or something like that. You can confuse. I had a child one time that had just come in from school and all of a sudden had these little white spots on the hair, and the mother was very upset, and she brought some of them in. They were actually aphids. So, the child had gone under a tree, and there were a few little aphids in the hair, so I was very concerned about that. But they're not snowy white, so I think that actually can be helpful. Now, if we talk about the life cycle, again, the eggs to adults, if we don't do any treatment, this cycle repeats after about 3 weeks. Basically, these nymphs are going to go through the maturity stage. They're going to become adults, adult females. They're going to be laying eggs, and then we're just going to continue to have the infestation. So again, eggs, let's say 7 to 10 days. A nymph takes, goes through 3 phases, so about 9 to 12 days, and the adult lives about 4 weeks or so or longer, so on that scalp that's not being treated. So I think we can see that we have about a 3-week or so cycle that this little parasite can go through. Now again, we talk about the incubation period. One thing I want to mention about the incubation period, and I think this is really important when we're talking to parents and talking to school nurses and people who have to deal with this, is that most of the time we're going to see the eggs, again, very close to the base of the scalp. And so if you see eggs that are, or even if you see casings that are further than ½ centimeter to a centimeter, then those probably aren't even viable, again, because they don't have an opportunity to feed. And the way a head louse feeds actually is very interesting. A head louse, basically, as it hatches out, these lice are injecting saliva into the scalp, and there's an anticoagulant in there, and this allows the louse to basically suck out a little blood every few hours. So it's almost like they're little vampires, if you will. But they've got to have that blood in order to survive. And that really leads to our talking about symptoms here. So why do people have itching? Well, as a result of that feeding on the scalp and that injection of that anticoagulant from the saliva from the louse really causes pruritus or itching. And this is probably one of the cardinal signs that I have seen as a pediatrician, is that kids start scratching the scalp quite a bit. And again, usually, you're going to see those nit casings, or you're going to see those eggs around half centimeter to a centimeter from the scalp. You may see crawling lice, and again, these are the adults, and you can say, well, they've had this for about 3 weeks if those adult lice are actually crawling in the hair. And as a result of this itching, you see these eggs on the scalp, you see the crawling lice sometimes. You can also see, the longer the child has had the infestation, excoriation of the scalp. And this is a concern that I see as a pediatrician in children who have not been treated, is they will have areas where they've actually scratched, excoriated the scalp, and sometimes as a result of that can actually get a secondary bacterial infection. And I want to speak to this issue for just a moment to discuss something that my pediatrician colleagues and I sometimes see, and that is a child that has not been treated early on. They're scratching the scalp. Well, what are the bacteria that we're going to see on the scalp? We're going to see strep. We're going to see staph. Sometimes children will actually have enlarged posterior cervical lymph nodes as a result of secondary bacterial infection. So that while the child has to be treated for head lice, what I tell parents, if I've got a severe case of excoriation, and I've actually seen this with secondary bacterial infection, honey crusting, really an impetiginous, an impetigo type appearance, I will go ahead and treat the secondary bacterial infection first, because that's much more significant. This child certainly could develop even an abscess of the scalp, a cellulitis. I mean, this is much, much more significant than the head lice. So I will go ahead and start that child on an antibiotic to treat that bacterial infection and really get that skin cleared up before I put an agent on it to treat head lice. And I think that's extremely important and a practice measure that I've had to employ in my career, and again, some of my pediatrician colleagues, and we've actually discussed the importance of clearing up that secondary bacterial infection first, because what's more significant to the child? Yes, they do have the head lice, but if we have a rip-roaring case of impetigo there, we need to get that cleared up first. And fortunately, after starting some antibiotics on that child, that should clear very, very quickly. It should, the skin should start improving, and then we can go on to treating our head lice, because we really don't want to be putting these agents on broken skin. So I think that's very important. Transmission of head lice, I talked about this just a little earlier. And again, scalp to scalp being most common. Fomites, actually one study showed that in bedmates that they only recovered head lice from the pillowcases in about 4%. So, again, the head lice just didn't have anywhere to live once they got off the scalp. So they like to stay there so they can remain viable, can, get that blood, can feed, and can go ahead and, go through the life cycle. So let's talk about practical points. Again, as I mentioned earlier, and I think this bears repeating, head lice don't transmit other human diseases. We need to be aware of that. I mentioned the feeding on the scalp. Head lice crawl, they don't fly, they don't jump, okay? They attach close to the scalp so that the further away you might see, even if you have an egg on a hair shaft, it hasn't, has hatched out yet. Again, the closer they are to the scalp, the earlier the infestation has taken place. And again, I've had children that have been treated for head lice and successfully treated, and then about a month later, the parent comes in concerned because they saw some white flecks, or they saw something that looked like a nit, and it was, about 2 inches or so from the scalp, and empty nit casings, and again, empty egg casings, if you will. These children didn't have active infection. They just still had some nits in the hair. And nits can be difficult to remove, and we'll talk about that in a minute. So, how do we diagnose head lice? Well, clearly it's visual inspection. And I think it's extremely important, and I did not include a lot of pictures in this presentation, but certainly you can go on the CDC's website, library of pictures. You can also look at other resources, medical resources, textbooks that show you what head lice look like. I think it's very important to know what a lice egg looks like, what an empty egg casing looks like, what a live head louse looks like. Now, head lice do not like light. They will crawl quickly. I've actually seen this happen. I tend to use an otoscope because I think that gives me a lot of magnification as well as light. But adult lice don't like light. They'll crawl quickly. So, I've had situations where I've put light on the hair, and the louse would very quickly, dart and try to, get under the hair. So it can be quite impressive. But I also remind parents that when we're checking children, it's easier to see the lice when the hair is wet. So that's something that's very, very important. When you're really looking for lice, you need to wet the hair. And I tell people, just wet the hair, wet the hair with water, get it really, really, saturated, and then you can separate the hair, look at the base of the scalp, look around the ears, and that's where you're going to tend to see the head lice. And this is why I don't generally, as a pediatrician, recommend that we check every child as they walk into school in the morning, because for one thing, if you're using a light, the lice are going to crawl away, and also you're not wetting the hair down. So again, I've made it almost my mission, if you will, in pediatrics to learn as much as I can about head lice so that I can help parents, help patients, and help our school nurses to be able to develop the most reasonable information for patients. Now, this is a head louse, if you will, a nit attached to a hair shaft. Obviously, this is quite a bit of magnification, and it doesn't have quite this pinkish color. Unfortunately, when you take pictures, sometimes they don't quite preserve the anatomy here. But again, that is attached to the hair shaft. The thing about Head lice, as I mentioned earlier, they secrete almost a glue, if you will, to attach them to the hair. So let's talk about treatment, and I want to be able to confine this information to treatments that have scientific evidence, that studies have been done. Now, there are other bits of information that are out on the internet that other organizations might have provided, but I'm talking about information that has been discussed in medical literature and that research has been done. Now, there are a number of agents that can be used. The over-the-counter, the two types of agents that are over-the-counter, one is permethrin. And permethrin, there is a trade name for this, and you can ask your pharmacist, but this is a synthetic pyrethrin, if you will. And this permethrin is basically neurotoxic to the head louse. But the good news about permethrins is actually came out as a prescription agent about 30 years ago, and now our over-the-counter agents came over-the-counter in the 90s. And these agents are have a very good safety profile in children. So again, the permethrins. And when we're talking about using the permethrins, the one thing that I do like to remind parents is these can be used with consultation with your healthcare professional in young infants. And again, I have rarely seen head lice in young infants. There's not a lot of hair there, which is probably good most of the time. But again, if that situation were to arise with the consultation of your healthcare professional, permethrins are approved to be used in children 2 months of age and older. The thing about using permethrins as an agent or any over-the-counter agent is that we have to remember, first of all, that we have to follow the directions. And again, I think as most of us, you know, in a recipe, we'll put a little of this, a little of that, but follow the directions. If you don't follow the directions correctly, then it won't work. And overall, one universal thing that I say to all parents when they're doing head lice treatment is that when you are rinsing these agents out of the hair, put this on and rinse it over a sink. There's no need to put a child in a shower. And as you rinse this off, have this go all the way over the body. While these agents have a good safety profile, it's just not necessary to have that kind of skin exposure. In addition to rinsing this over the sink, one other universal thing I tell parents, and I think most of us are very sensitive to this as parents, we want to use a warm or tepid water because we don't want to vasodilate. And the warmer the water, the more vasodilatation of the scalp, and the scalp is very vascular, so we don't use hot water, just a tepid or warm water, just enough so that, it's not uncomfortable, it's not, freezing cold water. Again, tepid to warm water, but not hot water. So let's talk just a little bit about how the permethrins work. As I said, it's a synthetic pyrethrin. It does affect the nervous system of the louse. And one thing that we want to remember about the permethrins is that this is the one agent that's really put on wet hair. So you want to wet the hair and then put the permethrin on the hair, leave it on there for about 10 minutes or so, and then, as I said, wash it off in a sink, wash it off in a sink bowl. And I want to give a little tip here, something that I learned as a pediatrician using this, and that is that once we put this on, that permethrins have a residual effect because they're not going to kill 100% of the lice. They're pediculicidal. They're not ovicidal. So you've still got those eggs that haven't hatched into the nymphs or the adult head lice. So it's very important to recognize that we're not going to kill every head louse there. We may only kill 70-80%. But the permethrin compounds will kind of remain on the hair, and it has a residual effect. So I tell parents, after you've used the permethrin and you've put it on there, you've left it on as the manufacturer's instruction, which is usually about 10 minutes or so, then you wash it off in the sink basin, and then you towel dry the hair, and then don't shampoo the hair for a couple of days or so, or even longer if you can manage, if your child's not outside playing baseball or getting extremely dirty. If you can manage to leave the hair without shampooing for a few days, that really helps. And then if you do shampoo prior to the time that you're going to repeat the treatment, then use a shampoo that does not have silicone or conditioner in it, because the residual effect of the permethrin will actually be negated by using that silicone or that conditioner on the hair. So I think that's an important tip to make people aware of. And then also be aware that with the over-the-counter agents that you're going to have to repeat these. And I mentioned earlier the life cycle. Well, you know, if you look at the life cycle, some of the studies initially, some of the information would say treat again at about 7 days. But if you look at the life cycle of the louse, now the American Academy of Pediatrics in their position paper that just came out in May, and also the Red Book that just came out earlier, I believe, about that time, said that you should probably retreat around 9 days or so. So a little bit longer than what was on the manufacturer's instructions. And again, pyrethrins, almost like permethrins, again, pyrethrins are natural agents that come from chrysanthemums. There is some information on the package insert about perhaps not using this in people that are allergic to ragweed, but I do tell people that they can use a permethrin if a person is truly allergic to ragweed, although the process that this is developed by is probably not considered to be a significant risk or problems. So I want to talk about the pyrethrins just for a second, to be aware that you can use them in children that are 2 years of age or above, again, over-the-counter agent. This is a pediculicide. Now, the pyrethrins do not have residual effect, whereas the permethrins do. So it's important to remember that you're going to put this on the hair dry. And again, the permethrin you're going to put on wet, the pyrethrine you're going to put on dry. And this is something that sometimes parents need to talk to their pharmacist about, or need to talk to their nurse, or even their doctor. And I've explained this to my patients. I go through very specifically how to do this correctly. And in addition to that, we have to remember that we are going to put this on dry, then let it dry. And then we're going to put it on dry, we're going to leave it on for about 10 minutes or so, and then we're going to wash the hair off with water, and then we're going to let it towel dry. So that's very, very important. We do have to also repeat the pyrethrine as well as the permethrin. Now, this is right before I'm going to get into the discussion about some of the information that's come out in the literature and people have called super lice. But let me finish up to say that over-the-counter treatments do work in many, if not most cases. They are less costly and they're readily available. I mean, you don't have to go to your doctor to get these. And again, they're much less costly depending on which agent you use, which pharmacy you go to. But the disadvantage, okay, I do want to throw out the term that has been used in the news. There really aren't super lice, okay? That is a term that was stated to indicate that some lice are resistant, okay? And we'll talk about those agents in just a moment. I did mention earlier about the nits and about not restricting children from school with nits. Okay.
Dr. Landers, can I interrupt you just a moment?
Sure.
And let's go back to the treatment.
Yeah.
We've had several reports of parents putting the treatment in the shampoo to use as a prophylactic for nits. Can you speak about this?
Yes, and Shirley, that's a very good question, and something that I've had parents ask me about. Well, why don't I just go ahead and I'll just use this once a month? Well, two reasons. Number one is that if the child doesn't have head lice, you don't need to do it. Mm-hmm. Number two is if you're mixing it in the shampoo, just as I've told you, if you're mixing it in the shampoo and conditioner, you're really negating the use of the product because, you know, as I mentioned, the permethrins have to be put on wet, but most shampoos, you have to Google to see which products, but most shampoos have some silicone in them, and many shampoos are shampoo conditioner combinations. So basically you mix it in there, you're really negating it. So you're taking the product and you're just mixing it in there, and then it doesn't work. So that's something that's very, very important. You don't need to make your own product at home. Again, as I mentioned, the treatment here, let me say something about the quote super lice unquote, and then we'll talk about what we need to do when we treat with an over-the-counter and it doesn't work, and then we have to go to the prescription agents, which I'll basically close by talking about the prescription agents that are available. Now, as I mentioned earlier, we saw a lot of information in the news around the, I believe, the middle of the summer, talking about, quote, super lice, unquote. And in the United Kingdom, for example, there is research that shows that there are some lice that are resistant to, for example, malathion, which is a prescription agent that has been available for a number of years in Europe and is currently available in a different formulation in the United States. So these lice that have been referred to as, quote, super lice, unquote, we have to remember that any organism that is exposed to an agent, a medication, there's an opportunity for that organism to develop resistance. And certainly there are some lice that are resistant. However, we have no indication that, you know, with a person who has a first episode of lice, or even an episode of lice after a good number of months after being treated, that there's no indication that louse is resistant. Now, what I tell parents, and again, this is actually something that's in the new Red Book, the American Academy of Pediatrics, if you treat the child, depending on which agent you use, and within 24 hours of treating that child, if you see some adult lice in the hair, and they're looking rather poorly. You know, these lice are just not really crawling around very active. They're just kind of staggering around and looking almost intoxicated. Well, remember, the permethrins and the pyrethrins affect the nervous system. So that louse is going down, okay? If you, after 24 hours or so, you see that you have a lot more eggs than you had prior to treating the child, again along the base of the scalp, around the ears, then those might be indications that there could be resistance. However, we want to go back to, first of all, correctly using the product. And I'm as guilty as anyone else about not wanting to read the directions. But in this particular case, it's a little bit of a trick. You got to read the directions. Again, as I mentioned, permethrin's going on wet, pyrethrin's going on dry. I mean, you got to remember that. Again, we also have to know that there will be some hatching after treatment. But if we have the permethrin, again, that's going to have some residual effect. If we use the pyrethrin, you know, we're going to retreat. We're going to retreat again in about 9 days or so. We have to consider reinfestation. Again, that's not usually so much of a problem after 24 hours, but maybe 5, 6, 7 days. Say, for example, we had one child in the house got treated, one child didn't. It's a good idea to check everybody in the house at the same time, treat the people who are truly infested, and treat bedmates. I don't treat everyone in the house if there's no evidence of infestation, but we have to make sure that we're correct on that. And then we consider resistance. So I'll talk about what we will do. Okay, so again, persistent head lice. Well, after 24 hours, if we still see some very robust lice going on there, and again, this is from the American Academy of Pediatrics Red Book, we, after 24 hours, would recommend using a different product. Again, we have the permethrin, we have the pyrethrin, they're both over the counter. And then we would strongly consider a prescription product if people have really, you know, significant, robust lice there. But this would require, and does require, going to your physician or your healthcare provider and getting this prescription. And of course, I have used some prescription agents myself, but I would have to say that in the last couple of years, I've been very, very aware of how many times I've had to use a prescription agent. And I do see a lot of head lice in my particular practice, and I've not had to use prescription agents on a regular basis. I had a parent to remind me that we used a prescription agent on their child last year, and that their deductible cost was $120. So again, prescription agents are very expensive. So again, we talk about there are ways to do this. Treat with our over-the-counter agents, follow up with second treatment. Again, I tell parents, if they're not sure about doing a second treatment, you know, consult with your pharmacist, consult with your healthcare professional that can provide you the advice regarding that. So let's talk about the prescription agents again as we close. And I do find from a scientific standpoint that these are very fascinating agents to use, and they do have some very good effectiveness. The problem is, I mentioned to you, they are extremely expensive. So let's talk about malathion. Well, again, we probably all heard of malathion. Any of us that have grown up in an area that's heavily into agriculture. And malathion, 0.5%, has been available in the United States for the last few years. And it's a very, very effective agent. As I mentioned, the other two agents that were pediculicidal. The thing about malathion that I guess kind of recommends it is pediculicidal, but it is also ovicidal. So you're going to kill the eggs as a result of using the malathion, and again, being very, very expensive. Now, malathion is an acetylcholinesterase inhibitor, so it goes after the nervous system of the head louse, just as I mentioned earlier with the permethrin compounds. Little different in the way you prescribe this in terms of treatment, and I always tell people you want to consult your healthcare provider. You also want to follow the directions that are on the label. We put this on dry. Again, it's another one of those that you put on dry, and you put, on dry hair. You put it on the dry hair, and you let it dry, but you have to leave this on for several hours, 8 to 12 hours. The biggest caution I tell people about we're going to use the malathion agent is this is flammable. And, many people think, oh, flammable, okay, well, a candle. But also we have to think about no hair dryer, no curling iron, no flat iron. I mean, who doesn't want to use a flat iron these days? So we have to be aware that these are all flammable agents, so we don't want to be using those items with a child that we've put this malathion in, certainly while it's wet. So we want to put it on, let the hair dry from the application, leave it on 8 to 12 hours, and then wash it off. And as I mentioned, we're going to wash it off over the sink in tepid water. The one thing that as I said, I mentioned this is ovicidal. It's also pediculicidal. It's a very effective agent, and we usually don't have to reapply unless you have live lice after about 9 or so days. So the malathion is usually a one-time treatment, and it's very, very effective. But the problem is that it's extremely expensive, and of course it is flammable. So again, we have to be careful about that. I find the benzyl alcohol to be a useful product because, again, this actually can be used in children as young as 6 months of age. Now, the benzyl alcohol has a little bit of a different mechanism of action in that it smothers the lice. But again, as it smothers the lice, we have to remember we wouldn't want to use this on, extremely young children. Actually, some literature has indicated that this has been associated with what's called neonatal gasping syndrome. So again, that's in very, very, very young children. That's why we don't use it on young children. Same thing, we're going to put it on the hair while the hair is dry. But we're going to wash this off. This is an agent we're going to wash off in about 10 minutes or so. And benzyl alcohol is more likely to have a retreatment. Again, a retreatment around the time that the life cycle of the louse would be. Again, about 9 or so days. So this is something to be aware of. That this is probably of all the prescription agents, probably the most likely one to have a retreatment because it is not ovicidal. Now, talking about spinosad, again, this also affects the nervous system of the lice. So we have to look at malathion, nervous system, spinosad, nervous system, also ivermectin, nervous system, and benzyl alcohol is an agent, as I said, that suffocates the louse, for lack of a better word. Now, the spinosad agent, same thing. It's ovicidal. It's pediculicidal. Again, you're putting it on the hair while the hair is dry. You're going to let it dry. Then you're going to wash it off probably about 10 minutes or so. Same thing with the spinosad. Again, very, very unlikely to have to repeat this. And probably the one thing that I can say about spinosad is that when I've had to use it, really don't have any trouble with nits. I mean, the nits, I'm not exactly sure of the mechanism of action, but the spinosad seems to get rid of the nits too. So it's something to be aware of, Final agent that I just want to mention, and then I'm just going to say that there is an off-label use of oral ivermectin. I personally have not used that. I probably would not use that without further consultation because it's just not something that I really think we should have to go to. But the ivermectin lotion, this agent is, in addition to affecting the nervous system, also affects the muscles, if you will, so that the interesting mechanism of action is basically, while it's not specifically ovicidal once the louse do hatch, they can't feed because of paralysis, basically of the swallowing mechanism. So it's kind of an interesting mechanism of action. We've used ivermectin as an anti-helminth, as a worm medicine. So it is something that, is safe to use, but not something that is used very often just because of the cost. And again, same thing, you're going to put it on the hair dry. You're going to rinse the hair off at about 10 minutes or so. But also, this is one of those things that there's the has the added effect of really pretty much getting rid of the nits. So I think as we look at the prescription agents, all of these are going to be put on dry hair, but the malathion has to stay on the hair for 8 to 12 hours, whereas the others are rinse-off agents. That's something to be aware of in terms of using any of these agents. Other considerations, and I want to close in talking about this so that we have the opportunity to answer any questions that might be out there. Persistent scalp itching, again, because of the nature, as we mentioned earlier, because of the injection of the saliva from the louse, this can certainly cause pruritus. So that just because you treat a child with head lice, you have to remember they may have persistent scalp itching as long as a week, and then with the over-the-counter agents, you're going to retreat. So be aware that you can see persistent scalp itching, and that is not a sign that you didn't get rid of the head lice. And this is something that I educate the parents that I, treat their children is, we're going to treat, but the itching may not go away for several days. Same thing about burning of the scalp. Now, I've really, fortunately, not had much problem with this as a pediatrician, but I do tell parents that, sometimes we may have to use topical steroids or oral antihistamines for pruritus if we needed topical steroids if we have burning of the scalp. Again, this is pretty uncommon, but I do make parents aware that it can happen. We talked about households, okay? We want to treat the infested people in the household. We want to treat the bed mates, or bed mates, depending, how children like to crawl in and out of the bed with the parents. We have to be aware of that, and if there's another child or there might be, kids sharing the bed with parents, then, we would need to go ahead and treat the bed mates. But everybody in the house does not have to be treated unless they are a bed mate or unless they have had head-to-head contact. Now, again, in many households, certainly in my household when my children were younger, you could not keep them either out of the bed or off the sofa. So, it might necessitate treating the whole house. But, you may have situations where there's not head-to-head contact, and in that case, we don't have to worry about that. I want to mention environmental cleaning, and I've had mothers call me in tears because they have done all of this household cleaning and their child has head lice. Okay, household cleaning is, really, I tell people use reasonable measures, and by that I mean reasonable measures would be to wash the bed linens, okay, machine wash appropriately in your washer and your dryer. The head lice is going to be killed in just a few minutes in a dryer. The washer, they're going to be beat to death, so you don't really have to worry about other than routine washing. I tell people to vacuum, not so much because I think that there's head lice crawling around on the floor, but just in case, their hair, maybe a hair, and, my kids used to like to roll around on the floors, and if there's hair and it's got head lice egg on it, it's a very, it's possible that they could get head lice from there. So just vacuum, but it's not necessarily go spray your whole environment. So I tell parents just, do your reasonable household cleaning, and if you just cleaned the house yesterday and your kids have head lice today, short of washing the sheets and the pillowcases, don't do that. Some people ask me about toys, and again, as I mentioned earlier, it's very unlikely that louse, once it leaves the head, is going to be able to survive. But if you have toys and you want to bag those up for a couple of days in a plastic bag, certainly as long as a week or so, the lice are going to die. They don't have any way to feed. They don't have any way to survive. So I want to leave a little time for questions here. I think this is, again, a very important topic and a topic that we need to educate as much as possible. But I also wanted to share this information with you. these are very current references. Again, you can see the American Academy of Pediatrics information just came out a few months ago. Same thing with the Red Book. In addition to that, communicable diseases in man, this is a new edition. And all of these references support that we need to have a measured and reasonable approach. We need to assess the situation. We need to use the agent that is most effective for that child and least toxic and least expensive for that family. And we need to follow the guidelines of expert bodies such as the American Academy of Pediatrics and the CDC to continue to do this in a way that is safest and most effective for our children. So Shirley, I'll stop here and ask you to review anything that I might not have covered or offer any questions that we might need to discuss.
Well, thank you, Dr. Glenders. And we do have some questions here. With the over-the-counter treatment, how many times can this be used without harming the child?
Okay. Well, that's a very good question. And again, we're very fortunate that the safety profile on the agents that I discussed is very, very good. You know, what I tell parents, I really go back to my treatment regimen. We don't want to use medication preventively. It's not necessary. It's not necessary to do, as you mentioned, some parents thought they might just go ahead and treat their kids just in case. That's not necessary. If they don't have lice, don't treat them, okay? And don't mix it with your shampoo, as we talked about, for obvious reasons. As far as how many times do we need to treat the child, well, again, as I mentioned in my treatment regimen, if a child has head lice, we treat them with an over-the-counter agent, and after 24 hours, we still have a robust infection. Again, you know, let me remind people that if the lice don't look so good, they, you know, maybe they saw an adult louse, but it was not looking like it was very, very energetic, then, you know, I'd give that agent an opportunity to work. Recognize that we're not going to kill everything else off. If we still have a very robust infection, then I would switch products, you know, either a permethrin or a pyrethrin or vice versa. But then if I still saw a heavy infestation after a few days, then I would go ahead at that point and talk with my healthcare professional about using a prescription agent. One thing I would not do, and I've had parents do this even with a light infestation or just a few eggs, I've had parents use these agents every day. Well, again, you know, fortunately it's got a reasonable safety profile, but it's not approved for that, so we should not do that. And we should consult with our healthcare professional about what other treatment would be effective for that particular child. As I said, I mentioned that I have used some of these agents myself with great success.
Great. Okay. The next question is, how long can lice live once that they are off the hair?
Okay. Well, that's a good question. As I mentioned, the eggs, you know, once they leave the scalp, you know, you got to remember the egg hasn't really had the opportunity to hatch and go through the nymph phase. So, you know, once that egg leaves the scalp, you know, pretty much in a day, they're done. Okay, they're done. I mean, they're just not going to live longer than a day. Certainly, a lot of information says on a fomite, a day or two, which would be like a hat, a comb, a piece of headgear, a pillowcase. They're just not going to make it. They don't have anything to eat. And in addition to that, an adult louse could probably live a few more days. But again, once it's away from a food supply, adult lice, I read in some literature that people had seen an adult louse still be viable after 5 or 6 days. But again, for the most part, it doesn't have anywhere to eat, so it's going to die.
Okay, well, great. We have a call.
Okay,
go ahead with your question, caller. Okay, go ahead with your question, caller.
Hi, I've recently seen some advertisements for products that say they prevent lice, to use it as a shampoo. Any truth to this?
There is some information that, I guess people might call them natural agents for lack of a better word. They're not required to be approved by the FDA for medical usage. And there are some agents that do advertise to be preventive, if you will. for lice, but there have been no studies on this information, and as a physician, I can't recommend that this would prevent lice. Again, I think the best prevention that we have is that if we have a child that truly has lice, then they should be treated and treated appropriately. But as a parent myself and as a pediatrician, I don't recommend that people purchase agents to try to prevent lice. Again, I'm aware also of this, and I get asked about that a lot, but I say treat the child that has head lice or the children that have head lice, but don't buy agents. And there again is a lot of information about natural products that might prevent or might cause the lice not to attach to the hair, but I have no scientific information on that.
Okay, thank you so much.
And Dr. Landers, we have another email. The email says, do you recommend a preventative such as tea tree or coconut oil?
Okay, and I think that actually speaks to the question that the other caller mentioned. And there's information that people say, well, I've used this product and my child has not gotten head lice, but that doesn't mean that they would have gotten head lice had they not used this product. Again, there's no scientific study on this. There's no indication that this is or is not effective, and I have read about these agents, but I cannot recommend those as a preventive treatment for head lice.
Okay, and we do have another email. If you have students living in resident halls, and if there is more than 2 or 3 students in different rooms with lice, should you contact pest control to spray rooms?
Okay, and again, that's a very good question. One thing I would recommend is if you had that many students in perhaps a dormitory or something like that, you might first of all contact the Alabama Department of Public Health.
Exactly.
Because we can provide quite a bit of educational material and more information than I've been able to provide in this hour. But in answer to that, again, just to reiterate the points that I discussed earlier, and that is that other than treating bedmates or people who have head-to-head contact, because of the very poor viability of the louse off of the scalp, it's not necessary to do environmental cleaning. The only cleaning that would be necessary is your routine environmental cleaning, such as vacuuming and washing the sheets and bed covers, if you will.
And treating.
Yes, right. Yes. Treating the patients, of course. Thank you.
Okay. We have no other calls or no other emails at this time, and I see that we're just about out of time. Dr. Landers, we do thank you for being with us today, and you have presented a lot of wonderful information, so I hope that our viewers can take a lot away from this. And remember, if you have any questions, you can still email them, and they will be forwarded to Dr. Landers.
Thank you, Shirley, and thank you to everyone for the opportunity to speak on this very important subject. I certainly take this very seriously as a pediatrician and as a parent, and the Alabama Department of Public Health stands ready to provide information and education on this. So again, thank you very much for joining us today.